Good afternoon, ladies and gentlemen. Thank you for coming here, and thank you for this opportunity to be able to speak in front of you. My name is Łukasz Dudzic. I am the Business Development Manager in company Hygosense from Poland, and today during the presentation I would like to show you how we are changing the primary healthcare. And as you see, subject of this presentation is actually a correct question. Is it possible to get the quality of a face-to-face appointment outside the doctor's office? But actually now, why I have chosen this question? There are actually a couple of reasons for that. We know that the developed countries face the problem of eldering societies. So actually that causes the costs of the social security grow. One of the more reasons is it is more difficult, more and more actually difficult to get appointment to the doctor. I mean, not only in Poland, but also in France, in Germany, in many different places. Now, going to the clinics, for example, with kids, there is a lot of cross-infections. Well, my wife going to the clinic with my children, actually, they always come back more sick than before because they meet other children in the waiting room. Am I right? Yes, that's exactly what's happening. So, and many other reasons that we can actually talk about. But the thing is that at the same time, the world is going digitalized. Actually, every aspect of our life is getting more digitalized. And everything is easier, faster. Everything is actually delivered to our homes. Whenever we want to buy something, we just buy it online, and we have it delivered to us. Now, but in all this development, actually the healthcare has more and more troubles and more problems. As I said already, there are less doctors available, actually everywhere, and the costs of the social security increasing everywhere. So, what started coming to which direction the medicine started going? Towards the telemedical solutions. And actually pandemic time has increased and fastened this gave a lot of speed to telemedical solutions. But the telemedical solutions actually face its own problems. Now, for example, the limitations of today telemedical solutions are very simple. For a doctor talking on the video conversation meeting with a patient, it's actually very difficult to get any real medical data. It is very difficult to make examination during the video consultation. Sometimes we are facing the internet connections, which actually finally causes that the kind of medical video consultation is not effective and takes a long time. So actually, some time ago, meaning many years ago, we started asking a question, a couple of questions. But the main one was how to improve it, how to improve that process. So actually, we started working with medical universities in Poland. We started working with doctors. We started working with nurses. We started working with patients, actually making some designs, making designs of hardware, software, failing, making discussions again, trying. And actually, finally, what we have obtained is we moved the medical process from the GP's office to any place and any hands. What it means, designing the solution, which I will show you in a moment, actually we were aiming 2 points. First, it was make it very easy for anyone, anywhere, to make examination without a doctor. And the second reason, second point, was to save the time of a doctor. How it works? To make it very shortly, patient can take the examination, can make the examination anywhere very easily without a doctor, for example, at home, and then the data is flying to the cloud where the doctor can see it on the computer in his office, make the diagnosis, and then diagnose, fly back to the mobile application, to the mobile phone of the patient. So actually what we have created, we have created the visit, first visit to the doctor, but without moving from home. Actually, probably we all know it, that like the 60 or 70% of the first visit to the doctors actually are not necessary completely. So let me start from the first point of the solution. This is Hygo. This Hygo device, which I have in hand. Actually, it's very nice, small, portable. So with this device, the patient can take, with removed the interchangeable modules. This device has 5 modules. So it has, as you can see on the screen, it has the derm hood, the stethoscope, throat exam module, it has otoscope and thermometer. So with this device, those 5 modules, we can perform 9 examinations. So we can perform, measure the temperature, we can make the video of the ear inside of the membrane, we can make the video of the throat inside, we can take auscultation with a stethoscope, which actually is here, we can take auscultation of lungs, auscultation of heart rate, auscultation of abdomen, that's especially for children, and we can take the video of the skin changes. So actually these are main examinations which doctors make for the upper throat infections. Next, after we take the examination with this device, as I said, the device flies to the cloud and the doctor on the screen, on the doctor's portal, can see the results of examination. So he can see all the movies, he can see all the pictures that has been sent, and he can hear all the sounds that has been taken with this device. Actually, it is very important that the device itself has the algorithms which decide and show to the patient, to the person who is taking the examination, if the examination has been made properly or not. Because the second reason, as you remember, of this device, of this solution, is to save the time of the doctor. So all the data that fly to the cloud, all the data the doctor actually see in the portal, this is the already data, diagnostic data. There is no option that the doctor gets something that he cannot hear properly, he cannot see, and the doctor says, okay, you know, this one, you have to do it again. So this option doesn't exist. This is already chosen here and sorted out by the algorithm in the device. And then, as we can see, the last third point of these 3 elements, this is the Hygo application, which is for the patient to receive the diagnosis. Now, we have 2 modes of this device. One is the family mode. This is exactly what I have described. So this is for home use. This is for people to have it at home. For example, for mom to take examination of children or older person, anybody. So this device, this model actually has been created for anyone who is completely non-medical to be able to take the examinations properly. So how it works? Hygo, the device, and one of the elements is the application. So, for example, when we feel like flu and we think, okay, we should go to the doctor now, so with the Hygo, we don't do it. Instead, we take the application and we fill the anamnesis survey, which takes around 1 minute. So this is exactly like discussion with the doctor. we put the symptoms. There are questions, so we mark. Okay, is there a headache? Is there a pain in the chest? Is there pain in the ear? This. This has been done really, not hundreds, thousands of hours with doctors, and this anamnesis service are really very good quality. So then, after filling the anamnesis survey, actually the algorithms in the application decide what kind of examination have to be done. And these examinations appear here on the device. So the person that makes the examinations at home actually do not decide which examinations to take. So then, step by step, clicking temperature or any other examinations which we have here, step by step there is a very easy explanation which module to use, how to mount it, where to put, how long to press, if it's good, if it's not good, if you have to do it again, and then it's sent to the doctor. So this is family mode for people to use at home. The second mode which we have is the pro mode. So this is for example, for the nurses or for the medical professionals, people trained medically. This is used, for example, very commonly in the point of care, in the places where people come, where there is difficult access to the doctor, but there is a nurse. So now nurse using this device can easily send the data to the doctor. Or this is very common, we have a lot of customers actually who take this model for the nurses' home visits, nurses visiting older people, or the elderly houses, where nurses actually take the examinations repeatedly to the patients. So this model is different a little bit because the definition is that the nurse, the medical person, is talking to the patient. So actually that person, nurse for example, is deciding which examinations to make. So actually, who is our customer? Who we cooperate with? So actually we cooperate with the governments, we cooperate with ministries of health, we cooperate with the clinics, we cooperate with healthcare providers, telemedical platforms, and actually there is a use case for both modes for many different applications. We have obtained after a lot of work and a lot of research, we have obtained the CE certification around 2 years ago, not even 2 years. And this is by the way, this is a medical device class 2A. This is not a prototype, it's already working. So after this time, we actually started cooperation already with the Ministry of Health in Poland, as we are from Poland. And since that time, we started going to many different exhibitions, and actually, we are pretty tired because it's everywhere huge interest in the product and the device and the solution. And we started cooperation with many different companies in many different countries, now in the testing phase or already in the use. So, now the Germany is actually a new place for us. So we are just entering this place, entering this market. So I encourage you for coming to our stand. We have a stand here to have more information about this. Yeah, and that's it. Thank you very much. Actually, in the end, I would like to thank our friend Paulina, who has made this presentation, because due to a lot of travel and work, nobody had time for it. So, yes, thank you very much.